Why nursing? Why not? Why nursing? Why not? What's going on? Peace Reese back in with another video, and this. What's going on, guys? Peace Reese back in with another video, and this video is on how I decided to become a nurse. Stay tuned. So out of high school, I was thinking about what my major was going to be. I was thinking about graphic design, maybe get an art degree or some type of BS degree that I would be able to just work a government job. At the same time, a few months later passes, I think about, let me do business marketing, because I did like ad work, I did do graphic design, and then I was going to do respiratory therapist 2 years after I got my business degree. And I'll get into why I thought about respiratory therapist. Before I get into why I decided to become RT, I just want to say, never doubt yourself. Alright? Just have confidence in you. So I was talking to my sister, like, what's a medical field that I can get into pretty quick? Because ain't nobody trying to spend like 5,000 years in college, you know what I mean? Like, okay. So my sister didn't really know about different types of like medical jobs, but she just said RT for whatever reason. And I was like, you know what? Let me just go ahead and research that. Let me see what that's about. So after doing some research, my cousin that worked at a hospital, who just now got accepted into PA school, she told me that I should do volunteering. So I was like, bet, you know what? That's what I'm going to do. Build some contacts. See how I like shadowing the respiratory therapists. And I was all like, all right, so I'm going to sign up. I did that. Let me tell you, RTs are cool. RTs definitely play a major role into patient care. But after volunteering, no disrespect, but after volunteering for like half a year and shadowing, I decided that type of patient care wasn't for me. They are first responders and they do play a major role because they do keep the patients alive. But I just wanted to do more things other than like, you know, chart and do breathing treatments. And that's what I saw after shadowing for like close to half a year. Decided that it wasn't what I wanted to do. Next big thing was nurses. The next big thing. This
bitch said I'm the next big thing. Shut the fuck up.
The next big thing. The next big thing was nursing. Nurses definitely play a big role. They are first responders in patient care, and they are the backbone of a hospital. Without nurses, doctors aren't able to do their jobs, and I'm almost 100% sure if you ask any doctor this, they'll agree. Even if they're in private practice, they do have nurses to help them out, so they play a big role. So I'm going to get into some of the pros on why I decided to become a nurse. Nurses are first responders. Nurses have a wide range of scope of support. You can really do anything in the medical field. Nurses are more hands-on. You have a connection with the patient. And at the same time, say you're tired of being a regular nurse and you want to play a bigger role, you can go to 2 years grad school and get your master's degree and be a nurse practitioner. You're basically a doctor at that point, but you're not. Just basically. Nurses are always in demand. It's a stable job. You can start your life faster. Nurse salaries are pretty good depending on where you're living and if you one day have a family. What I like about it the most is, okay, you're doing 3-day 12-hour shifts. Yes, they're 12-hour shifts, but you have more time to spend with your family or travel. So that's one of the pros as well. So now I'm going to get into one of the main reasons why I wanted to get into medicine. One of the main reasons I wanted to get into nursing, get into the medical field, and that's because, well, one of the reasons is my parents came from Afghanistan. Yes, I am Afghan. My parents came here dead broke. They were in debt. My parents fled during the war in Afghanistan years ago. It was a war against Russia. I might leave that for a story time for another time. But they worked hard to give me and my sister a better life. I cringed so hard at the fact that I stooped so low. There was this point where I thought about, oh, maybe let me get in and out of college, and I was being selfish. Let me work at the DMV, or let me get an art degree. No offense to anyone that wants to do that, but my parents came from a hard background. There are kids in Afghanistan who would be willing to do anything to be in the position that I am. And I want to use this platform to help them as well. I don't want to be selfish. I want to help as many people as I can. And this is one of the reasons why I'm starting YouTube. That I want to reach out to more people, not the people around me, more than that, like worldwide. There are so many kids in Afghanistan who don't know when their next meal is, who are injured, who are orphans, who don't have parents, who don't have family members. There are parents who don't have their kid due to these bombings, due to these terrorist acts and the war and all this. And I want to be there to help them. I want to give them a better experience. I just want to be there. I would hope someone would do that for me if I was there. You know, I don't want to just be this normal, regular person. I want to go out there and help as many people as I can. And hopefully this YouTube platform will help me to get to that position. And that's kind of the main reason why I want to become a nurse, is I want to be able to help out the less fortunate. I want to make my parents proud. I want to use this YouTube platform to help students, college students, high school students get on the right path. Because I didn't know what I wanted to do with my life, and I'm making these YouTube videos. I'm putting my effort into this to hopefully help some of you guys. So if you guys can please like, comment, share, subscribe, it means the world to me. Thank you so much. This was a piece of Reese, and I'm out.
Diamonds in my pinky look like water, make me seasick.